At this year's ASCO meeting, we will be presenting the results of the largest randomized controlled trial in smoldering myeloma, looking at lenalidomide versus observation. People will know that in the past, we've had a trial, the Spanish trial, which showed that early therapy of smoldering myeloma with lenalidomide and low-dose dexamethasone can prolong the time to progression and prolong overall survival. But for three reasons, that trial has not led to a change in the standard of care. One of them is that they used a combination of lenalidomide plus dexamethasone, so it was difficult to know whether the lenalidomide was working or the dexamethasone was working, and in which case the regulatory authorities are not going to approve that regimen. And secondly, they used a risk stratification method that was not widely available, and so it was hard to generalize the trial results. And finally, there was always a concern in the Spanish trial that they had not done adequate imaging at baseline, and therefore some of the patients enrolled in the trial might have had actually multiple myeloma and were watched, and therefore the trial results were again not generalizable. What we did in this trial was overcome all those three problems. We used a single agent, lenalidomide. We used a risk stratification method that's widely available. And finally, we also did adequate imaging at baseline. All patients had an MRI at baseline to make sure that the only patients enrolled were patients with truly smoldering myeloma. And what we see in this trial is that the prevention of end organ damage is significant with lenalidomide therapy compared to observation. And the magnitude of the benefit is identical to what was seen in the Spanish trial. So I think in concert with the Spanish trial, this trial provides data that justifies early therapy for asymptomatic patients with intermediate and high-risk smoldering myeloma. So that would be supporting a change in the standard of care.